सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखमाप्नुयात्. This is my favorite prayer from our scriptures, which is so universal in its thinking, where it prays for everyone's welfare. Sarve bhavantu sukhinah, let everybody be happy. Sarve santu niramaya, may everybody be healthy. This happiness and health does not come by just praying with our lips. It comes to all by working with our hands. While it is nice to pray for the welfare of all, but if that prayer is not accompanied by meaningful action, that prayer will not be fulfilled. So to make everybody happy, to provide them with their basic necessities, their basic needs, that's where happiness begins. You should have food in your stomach, clothes on your body, roof above your head, a good education, good meaningful work to do, a decent earning so that you can sustain yourself and family and lead a respectable life in society. These are basic necessities that can keep everybody happy. The other thing is, despite all these things, there is a possibility that you may not be healthy. At that point of time, the only way to be healthy is to be able to access healthcare, quality healthcare at your doorstep. Just a while ago, we saw 10 of the patients who've been operated in the last couple of weeks after the new operation theatre was inaugurated by the team of surgeons and medical professionals from our hospital in Raipur, Chhattisgarh, Dr. Ragini Pandey and team. They came over and with the team here at the Sarla Memorial Hospital, they worked and operated upon many children. Many of them come from nearby villages. And it doesn't require much intelligence to guess what must be their socio-economic condition. How many of them could have paid 3, 4, 5, 6, 8 lakh rupees in a corporate hospital to save their children? And what can be worse than for a father to see his child helplessly die, even though he can be saved because he cannot afford to pay for it? What can be more heart-wrenching for the giver of birth, a mother, than to see the apple of her eye die breathlessly in her own arms, not because there is no treatment available, but because she cannot afford that treatment for her child? What can be more devastating for a parent to see her helpless child suffer and still not be able to do anything about it? The guilt that the father carries for not being able to pay for the cost of the surgery, or the mother who carries the burden of giving birth to a child with a defect, can never be remedied unless until an institution like ours shoulders their burden, offers these surgery free of cost, so that there is no need for them to worry about where they will get the money to save their child. It is to the credit of our institution, so many of them, the Sanjeevani chain of hospitals, which is the largest chain of pediatric heart care hospitals in the world, which does everything absolutely free of cost. And our hospital, the multi-speciality hospital, the teaching hospital here, which gives this care to minimum 1,000 patients every day at no cost whatsoever to the patient. This is due to the relentless effort of our doctors, our nurses, our paramedics, our administrators, our trustees, our devotees, and our donors and supporters who provide for the need of these children who otherwise would not see tomorrow. And to me, it is a matter of great pride that we have such people with us, willing to work day and night for the welfare of somebody else, to save someone else's child, to restore their child in a healthy condition back in their arms. We have people like this, and that is the most precious thing that our institutions can boast of. And we have devotees and followers and supporters from around the world who have sent hundreds of crores of rupees over the last 10 years to support these institutions. Some of them have gone to the extent of mortgaging their property because I needed the support at that point in time. And when I asked them, what will you do later? They said, no worries, Swami. We are always working, and whatever we earn, it is for you. It is for your mission. And that is how they have supported this mission. And this is why this mission is so glorious, because of the selfless sacrifices, right from the watchman who receives, or the gatekeeper who receives the patient, to the surgeon, to the trustees, and those invisible hundreds and thousands of devotees who support this mission from tens of countries of the world, without thinking that this is another country and why we have to do anything for that. They all feel we are one country, we are one world, one family. With that feeling they support, and that is why we are able to give a new lease of life to these many children. What a pity, what a shame it would be that despite all of us being around, despite so many rich corporate hospitals being around, despite such a huge network of healthcare professionals and infrastructure in the world, so many of these children die because they cannot pay for their healthcare. What can be more cruel than this? To deny a child its right to live just because it cannot pay for it. Should life be measured in money? Is the question I always asked. And the pioneer in providing free healthcare was Bhagwan. When the first hospital he opened way back in 1960s in Puttaparthi and Whitefield, and then from there many bigger hospitals, he decided not to sell healthcare. He said healthcare is not a commodity to be bought and sold. You cannot decide if a person lives or dies based on whether he can pay for it or not. It's unfair, it's cruel, it's inhuman. It was his call to make sure that health is delivered as a free service to every needy patient. So also this was done for education. Education was not supposed to be a commodity. It is not a commercial project. Teachers are not vendors, and students are not customers. This is a very sacred institution where education is imparted with complete selflessness by the Guru to the Shishya. That is the country that we belong to. Bharat stood for free healthcare, free education, and free food, mind you. In India, anywhere you could go, if you were hungry, knock on any door. Even if you're a stranger, you don't belong to the village, if you just ask the owner of the house that you are hungry, I'm sure even today you will be served something, whatever be available at their home. And nobody is going to charge you back for that. This is the culture, this is the country, this is the glory of our country to which we belong. Unfortunately, with the passage of time, with invasion of selfish forces who only thought business and nothing else, those who colonized the country, they came here to take away things from this country, to do business in every aspect, including healthcare, education, or anything else. For them, it did not matter. But they left behind this psychology of looking at these basic necessities as commercial products, as businesses. And we haven't come out of it even after 75 years of independence. And that's really hurting. This must be changed. Bhagavan started with free hospitals, free educational institutions. But as the time progressed, we felt there is a need to provide free nutrition to the children. Out of 16 crore school-going children, at least 8 to 9 crore do not have proper nutrition. India ranks very low when it comes to nutritional index of the school-going children. That leads to wasting, stunting, so many other diseases. And ultimately, loss of productivity. All this had to be addressed, and that's how this mission came into existence, with Annapurna serving the morning breakfast to 3 million children across 40,000 schools, 23 states, 4 union territories. With education mission starting from here, Sri Sathya Sai Lokaseva Gurukulam, we started establishing campus one after the other, and what a trailblazing mission this is. That within the span of 10 years, you start with a school, you end up with a university and a medical college, all within a matter of a decade. And all this is for free. Nowhere, nothing is charged for anybody. And then you think of the healthcare itself. We picked up the most difficult specialty, pediatric heart. 250,000 children are born every year in India alone with heart diseases. And all the facilities put together, India cannot do more than 25,000 surgeries and interventions. So there is a huge backlog of patients who are living. You just saw Arokya Swami in his 40s with a congenital disease, heart disease, but never detected, never went to the hospital because if you go to the hospital and they tell you you have a problem and you need to pay a couple of lakhs to get yourself treated and you are not capable of it, just to avoid, they live in denial because they cannot face the situation that they'll have to pay for it and they have no means to do that. This must change. And I'm so hell-bent, I'm so committed to changing this. This cannot go on forever. That is how I think. So we did free healthcare, we did free education, we did free university. We ensured that the university students go back to these schools and pull many more out of the misery of ignorance and illiteracy. And that is happening every day. A new set of chairpersons, the new in charges, they are all young boys and girls in their 20s who are taking charge from those in above 60s, and now they are going to run these campuses. So also in healthcare, when I look forward, I look at 25, 30 years from now, I look at where do we get right kind of doctors, nurses and paramedics who will commit themselves to serving the poorest and the needy, who will pledge to serve the cause of free healthcare to the neediest people in the country and the world with all their skills and might. How do we build a force like that? So taking a leaf out of our success from the university, where we created the next generation teachers and administrators, and mind you, each one of them is a gem. It took some time for them to understand the mission, understand their role, understand what they can do for the country and its children. They took some time, but today they are gems. Each one of them is a stalwart, spiritually, academically, administratively, in every sphere. They're such wonderful children, young men and women. And then we thought, how will this healthcare reach to the last person who cannot afford, who cannot come to the hospital also? How will we reach this out to that person? And that's when the idea germinated here, that why don't we have our own medical school? We used to send our students to different medical schools, those who were aspiring to become doctors. But then we realized that the culture in those medical schools was not the culture that we wanted. And so we thought, why don't we create a system where we can invite children who believe in this idea of service to the humanity and who are willing to pledge their energies, their skills, their knowledge to serve the cause of free universal health care. And that is how medical college came into existence. And it's so fulfilling today, not because the medical colleges started, we did it in a record time of less than 2 years. The buildings were built, permissions were sought, all the faculty were brought in, all the money poured in, all the effort was made. Day and night people have worked so hard to make this medical college dream come true. And it was recognized and appreciated by the Prime Minister, the President, and the greatest leaders of our country, and even abroad. But all that aside, what makes me really happy today is that some child of a daily wager who thought he or she can become a doctor in our country, but everybody told not possible. Because what you have to do, even if you get into a government college with great rank, still you'll have to end up paying a couple of lakh rupees for your medical training. Education may be subsidized, but you'll have to pay for the hostel. You have to pay for your books, you have to pay for your travels, you have to pay for so many other things. And the child thought twice whether I should burden my parents for the sake of my medical degree. And many of them have decided not to pursue because they were afraid whether they can even afford that limited little fee that even is charged in government colleges. But today, when we saw the children coming and receiving their coats and taking the pledge, we saw how many of them come from such impoverished backgrounds. I'm told out of 50, 32 of them come from families that have less than $350 of income per month. And they are not the only children. child. There are others also in the family who survive on the same income, maybe even lesser than that. And that is the kind of children who are getting an opportunity to get educated and become medical doctors in times to come. That's what makes me more happy. That any child in India or anywhere dreams of studying something should not be denied that education because his parents cannot pay for it. That's cruel, or outright cruel according to me. That's inhuman. And that is what we want to change. So while this medical school will definitely provide the country and the world with one of the best set of medical professionals, extremely competent but at the same time extremely compassionate, it will also give opportunity to any child born anywhere in the world to dream and realize the dream of becoming a doctor. And his dream shall not be crushed because his parents or her parents cannot afford to pay for it. People warned me, it's a big risk that you're taking. You have no clue what you're getting into. I said, nobody knows better than me. I've thought through it. I've agonized over it for days and nights. I've had sleepless nights actually, thinking how are we going to do the next thing? How are we going to build the next building? How are we going to get the next permission? For months we have worked like that, shoulder to shoulder, each one of us. And today, it is there for all of us to see and realize what it is leading to, where it's heading. When I see these children, not that children who come from better families are any less. The Agni Pariksha was, sign up for a 5-year minimum service bond. Take everything free, no problem. And I really thought that if they sign up, it means there is in some corner of their heart, they know that they are bound to pay their debt of gratitude to the society. And that's good enough for me if they feel like that. Otherwise, most of the children feel entitled to all these things. In fact, abroad it is even worse. They think the government, the state is responsible for their education and it's their right to get it. Even I have seen the premier institutions of the country which give subsidized education at the taxpayer's cost. I was aghast, I was shocked when I went to the US, to one particular city. 30 to 40,000 graduates from India, from the top premier technology institutions are all settled in the US. They all got education at the cost of the taxpayers' money. Maybe India did not have enough opportunities to absorb all of them at that point in time in 70s, 80s, 90s. But things have not changed much. Slowly now the balance is tilting. But I do not want our children to leave our shores for the sake of greener pastures. Go to learn. I'm not saying don't learn. Go abroad. They have more knowledge. They have more understanding skills, more research. Spend time, learn. But come back and serve the country. We live in the village of Vishweshwaraya. Bharat Ratna is. Born in the same village, just across the road. Walked all the way to Bangalore to write his exam because he could not pay for bus ticket. Yet he went on to become one of the finest engineers that India ever produced. And his contribution in terms of the KRS dam and so many factories and so many other infrastructure contributions is making so many people's lives better today. He could have chosen to settle down in the UK, go off to America or somewhere. But he decided to come back and serve the country and make a difference. In those times when situations were worse, we were under British rule. And now every Indian, the brown-skinned, did not get the same opportunity. At that point of time, these people went abroad, studied, came back to the country. Abdul Kalam ji, to Sarojini Naidu, to Swami Vivekananda himself, to so many more, Mahatma Gandhi, to our Sir M. Vishweshwaraya. They studied abroad because there was no education here, came back and improved the country and people's lives. In these times when opportunities are many more compared to those days, our children must shoulder this responsibility of improving the lives of the poorest and the needy. Not those who can pay for it. They can anyway pay for it. They'll find some way to pay for it. They'll get the service. Corporate hospitals are there, dime a dozen, who will treat those people on priority, like VIPs. But there is a bigger India, the Bharat side of it as they call, which does not have access to any health care. And I come from Chhattisgarh, I come from a tribal area and I have seen the misery of women there. People carry the pregnant women and, make do stretchers with bedsheet or sari And by the time they cross the 30, 40 kilometers to the forest to reach the nearest road from where the ambulance will pick them up, the child is gone, the mother has bled to death. This is not something that has happened pre-independence. It's happening even today, even now. This is the country we also live in. And I've seen that you just go 200 kilometers this way, that way, and there are so many villages where there's nothing. There's a larger India which still waits for basic things. So my dream is to create an army of medical professionals who are committed to the cause of providing health care to the poorest of the poor in our country. And without charging a penny. They only have to give their skills, trust, and this organization will look after everything else. And that's a commitment. When I say 50 of you, when you graduate, you must join us back for 5 years. I also know it has implications. We have to absorb 50 doctors in our mission and pay them and look after them well, look after their families well. And year after year, 50, imagine, 250, 300 doctors, you have to absorb them in the mission. And that means a lot of work on my side and our side. While they study, we'll have to build institutions and sustain them, to absorb them, give them an opportunity. Individually, none of them can go and serve the villages. Individually, they have limited capacities. But as an institution, we are a force. And together, we can achieve so much more. And that is the idea of building this medical school. Definitely, it's a historic moment. More historic today because the kind of children that we have got. They are brilliant. They waited for their opportunity. They come from very difficult backgrounds, from faraway places. The parents are not those rich elite, but ordinary citizens of this country. But they also could dream of getting a medical education, and they're getting it now. That is why this moment is historic. It has never happened in 75 years of independence of India. And that is why I am thrilled, because we are making history. And I believe that with this, many more institutions will take inspiration, and hopefully, in times to come, more people will join this mission, more children will join this mission, and we'll take it forward. Mind you, children, you are 50 out of 1 million children who have qualified for NEET this year. You're special. We had a choice to have a 150-seat medical college also, because we had built the infrastructure for that. And when the inspection committee came and they said, why did you apply for 50? In fact, 50 was not even provided for in the NMC regulations. We went all the way to the Ministry of Health, central government, and requested, we want only 50 seats. We don't want more, but we don't have provisions for 50 seats. He said, why do you want 50 seats? People come and ask me for 200 seats, 250 seats. Because every seat is money. And you are talking about 50 seats when you have infrastructure for more. Why do you want that? I said, our people who represented, they said, we want to create very cultured and compassionate doctors. We want to work on each one of them. We want to give them a lot of personal time and attention. And that would not be possible if we have too many numbers. So please allow us, give us a special provision to take only 50 children for this year, which wasn't there as per the regulation. But they gave us the provision for 50 children because of this idea that we want to create cultured medical doctors, not just run-of-the-mill doctors who will anyway get the MBBS degree and somehow start practicing. But we wanted not only to get them qualified or make them competent, but make them more cultured and compassionate. They should live, breathe, eat, talk, this culture of India, this philosophy of India of Sarve Sant Niramaya. That won't be possible when we have too many people. So give us less. And they were surprised. Many people commented, you are a charity, you should make every rupee count, take more children, so that for the same rupee you train more people. I said, no. Quality is important for us, quantity is not what I'm looking at this point in time. Even if per child cost is more, we will bear it, but we will ensure that per child, every child gets very good attention and is developed into a very good doctor. More importantly, a doctor with a heart. That's very important for us, and that's how so many people cooperated, and today that has come to pass. And it's really a moment that is worth celebrating. As I said, it has never happened in India. In fact, when Mr. Amit Shah came, he told, I haven't heard about a medical college in India. I do not know about the world that is willing to give free medical education. That we need more medical colleges like this who can take poorest children also and give them the same quality, even better quality education and opportunity to serve the country. I think this is what is going to change the world. The moment you remove money from education, healthcare, or nutrition, magic happens. And that is what we are trying to create over here. I wish all these children and their parents who decided to send them to us. We are honored because they have trusted us this college, which is just starting. It is not something that is running for last 40, 50 years. This is the first time we have started. They've trusted us, they've believed in us, and they've sent their children over here. You have believed in this system, you have come over here. I know there are still a lot of questions to be answered, a lot of things to be understood, but you will learn over a period of time. I'm sure you will appreciate and you will congratulate yourself for the decision you have made to be here with us. And from this platform, because a lot of people from around the world are watching, I want to convey a big, big thank you to devotees from around the world who, with one word of mine, have poured in resources without thinking twice. And some of them are seated here. I can see them, who have given so much to this institution to make sure this happens in time. And I look forward to your continued support. Remember, this is just the first step. Our journey has just begun, and we have miles to go before we sleep. And therefore, I look forward to walking together all these miles that we have to cover till we reach the very last mile and give the very last child an opportunity to get medical education, irrespective of their socio-economic backgrounds. I'm very happy to tell you that next year, children from abroad, from our Nigeria ashram, from many other places are also planning to come, write the exam, and be a part of this mission, this global mission. So wishing everybody all the very best, especially to these young, bright minds who have joined us, and to their parents and all the devotees who are part of this glorious mission, placing our gratitude at the feet of Bhagavan Sri Sathya Sai Baba for making it happen. And again, bowing down to those selfless devotees whose sacrifices made it happen. I conclude for today, and we will talk more about this mission in coming times. Once again, lot of best wishes and lot of blessings to all of you.